Hello and welcome to another episode of Toppers Talks with MedSchool Grammar. Today's episode is a little extra special because not only do we have All India rank 15 of INI-CET, but also a senior of my own medical college and my mentor through MBBS, the brilliant yet humble Abhishek VIshwanathan. He achieved this feat in his very first year after MBBS without an extra year of prep. And I have a lot of questions to ask him. So, welcome to this segment and thank you for being here, Abhishek.
Um, hi, Devika. Thanks for that intro. Means a lot. And yeah, fire away. What do you heard?
All right. So let's start with what was your goal when you started out? Or rather, when actually did you start your prep and start thinking about giving the exam?
Uh, so if I have to say that when I started like completely, like with full focus, that would be after my convocation in June, like this year June. So it's like five months out, and June 10th ish. And okay, when I decided that I'll be giving INI-CET or I should be focusing on INI-CET, that'd be sometime early this year, Feb. That's when I actually thought of it. Yeah.
Okay. So people usually take long breaks from their internship or skimp out on the work to prioritize their studying. And I know for a fact that you didn't do just your own, but a lot of other people's share of work during your internship. So, how did you manage all of that and yet come up with such a brilliant rank?
See, the point is when we started off with our internship, that's in 2022. I started off with chest. It was a relatively mild posting, so I could finish chest during that period, like 7 days or something. Uh, but then we went through, the tougher subjects, the more heavier postings. Medicine at one point it used to be just one intern per unit, and that used to be really taxing. You couldn't study at that point, right? So I think it was a judgment call, and you had to make it, and you had to decide whether you would be comfortable giving not your best and get a rank like 3,000, 4,000, and try to get in whatever you get, or just learn things during your internship, and then we'll just put uh, put a mind to it at the end, and just focus on intern and on INI-CET, or for that matter NEET after internship. So yeah, that's the ideal.
Yeah. So, what would you talk about, or what would you say was the advice for students um, preparing for this in their internship year, students in their final year, and students before that? Because I'm pretty sure the advice will be different for each of these categories.
Yeah. So if you are if you're starting before your final year, focus on your standard textbooks. That has to be the aim. But at the same time, I think the trend has changed now. When I started out, that would be end of second year, and I would say I was on the later side as compared to a lot of people. I think you can start off with marrow or things like that at the end of your second year. The problem is when you start all these new things, it takes a while to get adjusted to. It's not like you just decide I'll do 3 videos a day, 4 videos a day, because initially you want to go through all those videos as well. You don't even know what is important, what's not. You can't even see your paper and think, okay, this is important, this is not. It's very difficult to do that in your second year. So I think it has to be standard books, but especially in your first year. In your second year, just start adding your marrow or prep or something, bits by bits. I mean, you don't need to go all out into it, but you should start at least by your fourth sem or fifth sem. That would be very ideal. For a person who's in his final year, should it's very difficult for someone in the final year to focus on INI, because there's a pressure of your own professional exams, right? However, if you focus at least on your final year subjects and you can just cover your final year subjects really well, I think that puts you at a pretty good advantage at the end, because all you're left with is what your third year subjects and Short subjects also you should actually be covering in your final year. So only thing you're left with is your third year subjects. First and second, it's expected that you will do bits and pieces with your final year, right? So if you're doing something like medicine, you're doing viral hepatitis, you want to go through your patho from your second year. If someone you read about malady, dengue bodies, and whatever, so you're probably going through patho as well. So at least in bits and pieces, you're covering up second year, even if not first year. First year in anat, you're probably doing a bit in surgery, you're doing surgical anatomy. So these are things maybe you can put together in your final year, okay? And then in your even in your internship phase, you should still read a bit before going into your revising thing. You don't need to start revising on day one of internship. You have 12 months. You don't need to just rush behind all of those things. Internship, uh, if you're in your intern year already, and if you're not studied, I would say prioritize what you want to do at the end of it. Do you want to be confident enough at the end that if someone comes to you, you not just look at someone die in front of you. That is one. Or whether you just want to study and just get done with it, be a kamchor intern and run away. Uh, it's really your thinking. It's You have to decide what you want to do as an intern, but as a final and pre-final, you better start studying and start in integrative sense, like study in an integrated sense. That's what I would say.
Okay. That's very useful advice. Can you give us a breakup of your 5 months or before that, your prep, really, what it is that you did?
So till final year, we've all studied. I studied standard books. I didn't go a lot of local things. Uh, During my internship, I knew I cannot give INI in the same session. I knew I won't do well with NEET. So I focused on my procedural skills in internship. At the same time, I made sure to cover my short subjects. So that was the aim. At the end, I don't want to go back after my internship gets over and waste time over short subjects. I don't want to go read glycogenolysis and gluconeogenesis for the first time after 5 years immediately after my internship. That'll take a lot of time. So that was something that I did during my internship. Immediately after internship, the plan was to read everything thrice by November 5th. So the aim was actually slightly different. My aim wasn't to crack INI. My aim at the end had come down to I need a good rank. So even if I don't get a seat in INI, I want to, I want to have that confidence that I'll crack NEET quite easily. That was the aim. And I just wanted to go through the entire syllabus about thrice. So you can consider that as one reading and two revisions at the end. Couldn't make a lot of time for the third one, so I just skipped that. But I put in time for the other two revisions.
Okay,
Yeah,
that's pretty amazing. And I think you went way beyond your aim of just getting a decent score.
surprised me a bit too.
Right. So, what were the resources that you used? Was it one? Was it a combination of different things? And what was the purpose of each of the resources that you used?
I kept it simple. Uh, I stuck to Marrow. I've been using Marrow for I don't even know how long now. Just started the end of second year, so yeah, you can count. But at some point, I felt like in first year there was a mistake that I did. I had Guyton, I had Ganom, and at some point I was trying to make answers out just to pass professional. At that point, the aim was very simple, right? No one focused on all these big things and stuff. So at the end of first year, I realized there's no point in doing all this nonsense. At no point will you be clear with even one of those two books. To you won't have a clear conceptual understanding at the end. So the point was to stick to one standard book, like as much as possible, keep it to one, and your Marrow notes or prep or whatever. That is the idea. That was the idea behind it. I chose Marrow. It was quite the hype at that point, and yeah, it worked out for the better. Yeah. So that's what mainly that was the plan. and yeah, standard books all the way.
Okay. And so Marrow was the notes that you studied from. What about different tests that you gave, mock tests and practice?
Uh, See, so here's the thing. If you, I'm adding QBank to this as well. Okay. Uh, if you start splitting Marrow QBank with your studies, you have basically come to a point where you lost the plot. Okay. They are, they go, it's a harmonious thing. They go together. You should not be splitting them. That being said, I know it's very difficult to find time for all this, but my advice would be to read a topic and go through question banks and make notes of the question bank as well, because a lot of what does not, a lot of what that's not covered in your uh, Marrow notes or your videos get covered up in your question bank. Especially the analysis under your question bank and Marrow really works really well. So that is something you should be doing. Is what I that's what my advice would be. Regarding tests, I never gave a test till I finished my first focused reading. That's till August. That's when I started giving grand tests. I might have given, I think, 8 grand tests till uh, my last one was, I think, October. I think the mock INI that comes. Uh, my ranks were consistently on the, the better side, and I think that just boosts a bit of confidence into you that you can go get it. But there's a slight misconception that I feel that people are using grand tests to analyze what subjects you're weak in. I know Marrow gives you that analysis, but more than that, I think you'll be better off while by solving subject tests. I know Marrow gives you that analysis. Okay, the point being there's some amount of luck in it. That meaning per subject you have, let's say, 4 questions, 5 questions. If you know those 4 questions, okay, you'll feel that you have done really well. But your subject is not limited to your 4 questions. So that's where I think your subject tests take, uh, the higher, they should get the higher preferences, what I feel, as compared to your grand tests.
That's, I think, a viewpoint that nobody else has ever given. So that's really amazing. Um, Also, how much weightage did you give to solving versus reading? I mean, in terms of time commitment and whatever.
See, like I said, I had 4.5 months of doing nothing. Basically, I've done nothing. I sat at home and studied. Uh, you should, like I said before, you're not supposed to be splitting those two things. Don't go about reading, or just don't go beyond solving. None of those individually help your concepts get better. Maybe you'll be at a better point than what you were before, but then doing both together gives you that confidence that neither of them will give you a little. So I used to make it a point that by the end of the day, maybe I'm not reading and solving at the same time, same hour, but by the end of the day, I want to finish whatever I've, at least solve all the question banks that I've done of the topics that I've studied in the day. That was the aim. That was the aim throughout.
Yeah, that's amazing. Also, you spoke about adding or making notes based on the questions that you solved, and adding to the notes that already exist. So, did you make your own separate notes, or would you add it to your already existent Marrow notes? What was your system?
So I bought Marrow notes very late in my preparation. Actually, I bought it in June or July this year. Uh, Before that, I had my notes for everything. My main perspective of buying Marrow notes was that whatever I had were 2 editions too older. So I didn't want to miss out, have that fear of missing out, right? You've done something. For example, that antepartum hemorrhage thing,
Mm.
wherein there's a change in the newer editions. So that is something. And I think if I just sat and had to, if I didn't buy those notes and if I had to go and look at every update that has come through, it'll just eat up a lot of my time, especially since I had 4 months for INI, which makes no sense.
Right.
So I just didn't break my head over it. Just got the notes. Uh, Majority of the subjects I had my own notes. Uh, Few subjects where I didn't bother making my own notes would be. See, I'm really having to think. Uh, OBGYN, I didn't make uh, notes for all topics. I had notes for all the important topics, but like I said, it didn't really matter at the end because everything changed. It seemed like it seemed as if everything has changed, even if a lot of it is the same. That's one. Second is medicine. Medicine own notes, start to end own notes. Uh, I just felt that it's better. Uh, yeah, I think it's better if you have your own notes. You just keep adding things. But if you're in your end stage, I mean, if you're 6 months, if there's only 6 months to go for your exam, don't break your head over notes. Just fight it.
That
And
makes sense. That makes a lot of sense. Okay. So, tell me something. 4.5 months and 19 subjects. I know you did the short subjects during internship year, but I mean, it's still also three readings of it. How do you manage that?
uh, first is I uninstalled Instagram, so I save 12 hours a day. Uh,
Okay.
and I think it just came down to a point where if you have nothing to do at home, just sitting, I think you will also want to feel productive. Okay. So just start in the morning and just keep going. So initially, when I actually made my schedule, I wanted to stick to a timetable, at least a deadline, if not a timetable. I give it, I think, 8 days or 10 days for medicine. That was my first subject that I started immediately after my convocation. Uh, at some point, I realized I don't need to give 10 days, and I
Okay.
made a schedule that went up till August 15th for the first week. Uh, I did the medicine, I did surgery, and I was able to pick up pace and a significant amount of pace. To be honest, I gave 7 days to surgery. I ended up completing in three.
Wow.
So, so that's I think that I don't think that's specific to me. I think that just comes when you are in that zone where you want to just push. So I could actually end up completing my first week by end of July.
That's brilliant. Okay. So tell me retrospectively, what do you think you did right in your preparation, which you think everyone should definitely do?
Prioritize. If you know you're not cut out for INI-CET in this very attempt, or you can't give it in this. For me, my first attempt should have been the May attempt, which I didn't give because I knew it's just not. I just can't. I just didn't go, and I just didn't want to go and seem blank in that exam hall. And then you feel more disappointed than motivated. I think that your mindset is all that matters. In internship, you can just you know decide. Like I decided to give more time to what I actually do in internship rather than study. You could do the exact opposite and end up with a rank in the same. Yeah, you can take. I'm pretty sure some colleges allow you to take a few weeks off for your NEET and then cover it up later. So that's on you. That's absolutely on you. But I'm really happy that uh, I did that. I'm really happy that I prioritized, not because I could focus on this, but because of the fact that it gave me good clarity on what I did not want to do in my life.
Okay.
Basically, if I'm sitting at psychiatry at night, if I'm doing a psychiatry as a psychiatry intern, if I'm doing a night shift, I don't want to do that in my life. I can't practically imagine myself sitting and doing. At the same time, it's a surgery night call and you have a trauma patient, RTA, stab, something. And there's a thrilling case that you want to do. Same for gynae. We got a chance to assist a lot. I know, I'm pretty sure you're also getting the same now, being in the same college. But yeah, I've assisted significant number of surgeries in gynae. Sorry, OB. I'm talking specifically about LSCS. We have delivered a lot of kids. So yeah, so that was something thrilling as well. So that was actually my second option to.
Oh wow.
So gynae was nowhere in my list before internship, but that ended up coming to a second position in my list. So that is something very important. I knew I could get IV lines in kids, but I just couldn't handle cribbing babies and just pissing everywhere. You don't want to do
Yeah.
that in your life. I want to stay out of it. Uh, so yeah, it taught me what I did not want to do in my life, and I think it's important now that I have very less time to go for counseling and everything. That's very important. So yeah, I think that I did right, and that's what you should prioritize.
Right. So, what do you think you did wrong during your prep, which you think no one else should repeat or that wasted your time? It may not be something massive and oh my God, I wish I could, if I did it over, I wouldn't do that. But what is something that you felt you could have done better?
Stop listening to people.
Okay.
You should definitely stop listening to people. I had a lot of people who said that I should be giving NEET in the first attempt. Just as a joke or whatever. You should just go and give it. I think I did well by not listening to them, and I think I should have done that more. But
Okay.
from a more serious perspective, uh, fine after the end of final year, the end part of final year and your internship is not the point where you should go beyond standard. You should be roaming behind standard books. Is what I would say if you are going to give NEET in your first attempt at the end of your internship, because
Okay.
it'll just hog up a lot of time and it's just not practical. You can't remember so much. You make notes. Your notes will be bigger than the book itself. What are you going to study? You can't study all those things. You can't revise. Your mind cannot practically handle all those things.
Makes sense. Right. Okay, so now tell me, what was your last 1 month before the exam like?
Uh, See, like I said, I wanted to get 3 readings out. Right. My third reading was after my INI mock. That was October 13th or 14th or some time somewhere around that time. So last 20 days, I didn't want to focus on everything, but I think again my prioritizing work. Uh, there are some subjects which I'm good at, but they need time for me to revise. Two of those, medicine and pharmacology. I was better at those, but then I knew they would eat up a lot of my time. Uh, so I gave I think 6 days to just those two subjects. So I wanted to give it that much. Uh, After that, I focused on specifics only. I didn't go behind reading everything and anything and everything. It didn't make any sense. I left all the volatile bits for the end. And I had this plan that in my second read, that is before me giving that mock, I did OBGY at the end because I thought that is something I'll forget. And so, and I ended up doing OBGY again within 15 days of my last read. So I could finish entire OBGY in 2 days. And yeah, that was a boost because I thought OBGY will end up taking 4 days and I wouldn't be able to revise other things. But I still had to do OB. So yeah, that's one. And all the volatile subjects, I did revise anatomy separately. So I did miss a few questions of anatomy in my INI. And yeah, these were questions I knew, but I hadn't revised. So I think I should have made it a point to revise anatomy. I still did parts of it, neuro and anat. Uh, my last 7 days, I ended up doing short subjects, 2 a day. And I did micro. One full day, I ended up doing micro, and the rest of it, I did 2 subjects a day. I used to do physio and FMT in one day, or combining anesthesia and dermatology in one day. These are, uh, to speak frankly, haath ka marks.
Okay.
These are in your pocket. If you don't get these right, then you're just losing out for no good reason. Something of that sort.
Right.
So yeah, that's one.
Okay. What
I
was the
think the video.
last day before your exam like?
Wait, I think the video froze for a second. Can you just repeat what you said?
So I said, what was the last day before your exam like?
So my plan was my third read would get over on 3rd of November. So I get 4th to myself and 5th to exam time. Uh, Problematic thing was I actually had planned for doing things on the morning of 5th, assuming the exam would start at 9 o'clock or something. They ended up calling us at 5:30, so that took a hit. Uh, so yeah, that's also my advice for the people who are going to be applying next. Now, don't keep anything for the morning of the exam day. You can't do it. You won't be able to do it. The previous day, I made sure that I wanted to revise things that are frequently asked and you frequently go wrong, but these are again easy questions. Of these biostats, INI-CET, I saw I had a lot of questions on INI on biostats before. So that was one. Biostats, all the formulae basically, including pharmacology and biostats, screening, epidemiology, all of those things. Uh, General pharmac is something I gave a bit of time to. I might have given an hour or so to general pharmac. Uh, I read a bit of general patho and stains and all of those things for revision. Ideally speaking, you should have an idea of what you want to revise. I didn't have that clear of an idea, so I might have missed a few things as well. Uh, Entomology is something that I missed, but then I had to cover up for it. So I just ended up doing vectors versus diseases cause and pharmac, just doing the mechanism of action and drug of choice. That's it. Uh, Other thing was genetics and syndromes and triads. This is something that I did on my last day. I made sure I had good notes before for these, and I think this is where they're not. There's not a lot to ask. It's usually repeated, or you usually heard the syndrome somewhere or the other. You have heard the syndrome. So I think it's just a matter of revising on the last day. Triads, I had a list of triads. I just made sure I made my mother write them for me. I just gave her the book. I just told her just go through the entire book and whatever you think is a triad, just write that down. I will look at it at the end. I also made her write IPC, the list of all IPCs. So I did IPCs on the last day. I did this on the last day. By the way, IPCs, Marrow, the end of Marrow notes does not cover everything. You still have to do IPCs from Marrow Q back. So that's what I made my mother do because I didn't have any time to. Syndrome strides, like I said, you have to be really good at it. What is autosomal dominant? What is autosomal recessive? All those things. These are things that you think you know. At the end, in the exam hall, something very different happens, and then you are just flabbergasted. So it makes no sense. You have to revise all these things before. Uh, Something that I was always terrified of was doing diencephalon for some reason in neuro and I just never wanted to open that chapter. Like one question, who wants to do this nonsense? Who will waste time? I saw that Marrow Q Bank. There was a box under that Marrow Q Bank, and that box itself took me a lot of time to read what's in that box. But on the last day, for some reason, I ended up giving time. I think we got two questions of diencephalon in the paper. One was an image-based cadaveric question where they marked the thalamus or something, and that was under, I think they marked the fornix or something. They're like, where do the fibers go? These are things that I never read. Uh, so yeah, I got these in the exam. In the morning, yeah, there wasn't a lot of time, but I did scorings in the morning. I sat outside the center and I went to scorings. I had a book for scorings. I just written out all scorings. I had a list of HLA versus diseases, at least for immunology. Sorry, for rheumatology basically. Even if not others, just at least for rheumatology, I had that and all the antibodies. So that is something I revised just before going to the exam. Something that I missed revising would be developmental milestones in pediatrics. I never bothered to study pediatrics for all practical purposes because I just thought everything gets covered in medicine. Only thing you need to do is general. I gave 3 hours to it, and that's it. Nothing specific. But I did general from Ghai. Uh, I gave it some time. I made notes out of it though, so just the notes, but out of Ghai. Yeah, I I when I said standard books earlier, I didn't mean Nelson or I don't mean Harrison, by the way. I just mean things which are at your level. It might just be Davidson. You don't need to go through Harrison. I have notes of Harrison. It is absolutely useless. Even
Of
I
course
can't
not.
understand what I wrote. So it's a big question mark. So maybe the next 40 days I'll figure out what that actually means, or maybe in the next 3 years I'll figure out what that means. So yeah, stick to standards and stick to your basics, and it'll be fine for your exam.
Awesome. Okay, now one cliche question. What was an average day for you like during your entire prep schedule?
Obviously, you know about the internship. You're doing it now in the same
Yeah.
college, so you know how hectic it gets. Uh, so I'm not going to go into that.
No.
Uh, Basically, the saying, never studied. For all
Hmm.
practical purposes, never studied. Uh, I used to start my day around 9. Uh,
Okay.
and I know for a fact that after the initial 4 or 5 days where you actually got that boost, you get scared. Okay. Because this is a point when you're just sitting at home and you're like, your parents just looking at you and probably judging as to how many months are you exactly going to sit here. They know you've done well in your MBBS or stuff, but then you probably still think after a point they'll just come behind you with a chappal, like go leave the house or something. Uh, yeah. So you get scared. So at one point I was sitting till 3 in the morning. Obviously, I was not studying the entire time, but then made it a point that I can sit, just cover from a timetable basis. You can jump to a deadline basis. So आज का ये है, आज का ये खत्म कर, that's it. क्यू बैंक है, क्यू बैंक खत्म करना है, ये पढ़ना है तो ये खत्म करना है, nothing to be left for the next day. That was the end. It's just going to be adding up at the end of the week. I didn't keep any buffer days. That was a mistake that I did probably. Maybe people who are going to be giving INI can decide on that. I didn't keep any buffer days. I had one buffer day after my entire reading, and that also I made just to make notes. I was overconfident that I had notes of everything. After solving questions, I realized I don't have notes for half of the things because you have never solved QBank before. It's all reading, reading, reading. You have no clue what you're supposed to read. You're just reading like anything. So yeah, if you're starting new, uh, pay some heed to QBank. Consider QBank as a part of your preparation or part of your first reading rather than something separate as to test your skills. Okay. It's not exactly meant to test your skills. It is meant for you to, apply what you have already read and just get a new info on some things that you're missing. That's it.
Right. What was the first thing you did after you got your result?
I panicked. Uh, I told my mom. Then my mom panicked. And then we used 4 other devices to see if the result was magically changing in any of those devices. Uh, and for the next 2.5 hours, I was still in a state of shock because I didn't expect this. I was expecting a good rank. This turned out to be pretty good. Yeah,
Which
and
is
I
pretty
still keep checking though. I still keep checking just to make sure INET doesn't release a new result saying, "Hey, bro, that was a prank," and you know, yeah. Uh, I don't know what to say. It's good, but once
yeah.
that they sent, I think you could access your your rank letter from your login page. I think that's the moment where I realized, okay, you made it. Yeah.
Yeah, I think other than you, nobody else really doubted your rank or your performance or anything. It was believable to everyone else.
Yeah, well, thanks for saying that. But I'll definitely be paranoid. I,
Uh,
I, I, I really don't think that helps me a bit.
so what's next now for you? What do you plan on taking? Have you thought about anything?
Uh, I wanted to do medicine. So I think with my rank, I shouldn't be having a problem in getting a seat. Uh, my second option is, like I said before, gynae, and that's just another, just an entire polar part. So Yeah, but I think I'll stick to medicine.
Okay,
Yeah,
sounds good.
feels feels like home. Yeah.
Amazing. Okay, I think that's all the questions that I have. Do you have anything else that you want to add to anyone giving their INI-CET or NEET soon?
Prioritize and keep it simple. Don't break your head. Don't be bothered about what the second guy is doing, what the other guy is doing. It's not going to help you. And give tests on and off, and like just make sure you're on the correct path. If your ranks are getting better by the day, even if you don't have a good score in INI this year, or whenever you're giving it, even if you don't have a score, and so I think it's, you should still be pushing yourself to better. I don't think you should be giving up just because you shouldn't be getting demotivated because of that score. At the end of the day, that's all it is. It's a score.
That makes sense. Thank you for giving us so much of your time and just giving us so much valuable advice, because there's a lot of stuff here that honestly haven't heard before. Especially that grant tests are not a way to check which subjects you're weak at or strong at. That's something I haven't really heard before. So thank you so much.
Yeah, my pleasure.
All right. All the best for everything in the future, and obviously stay in touch.
Yeah, you too. Thank you, and yeah, have a nice day.
Yeah. Bye bye.
Bye bye.